Good morning. Today we will see the remaining portions of give reasons from medical surgical nursing. The first question, fluid intake is increased in patients on chemotherapy. What is the reason for increase the fluid intake in chemotherapy patient? Chemotherapy and radiation are the treatment which can cause dehydration due to the side effect like fever, vomiting, diarrhea or excessive urination. As we all know, one of the major complications of the chemotherapy is vomiting and diarrhea. So this chemotherapy can cause nausea and vomiting which can lead to dehydration. Drinking more fluids can help prevent dehydration and replace lost fluid. Additionally, diarrhea is another common side effect of chemotherapy that can also lead to fluid loss. So increasing fluid intake can also help to replace these fluids and prevent the patient from the dehydration. The second question, hypovolemia must be corrected before giving dopamine. Dopamine is a medication which is commonly used to increase the blood pressure and improve cardiac output in patients with hypertension or shock. However, dopamine works by increasing release of norepinephrine which can cause vasoconstriction and reduce blood flow to the vital organs. So, in patients already with the hypovolemia or low blood volume, dopamine administration may further decrease the blood flow to the vital organs by constricting the blood vessels. So, that is the reason why. So, it is important to first address any underlying hypovolemia by administering intravenous fluids to restore the blood volume and improve perfusion before starting dopamine therapy. So dopamine is not given in hypovolemia shock. It can be given the other type of shock like cardiogenic shock or neurogenic shock, but it is contraindicated in hypovolemic shock. Next question, patients who had craniotomy elevate the head end of the bed to 30 degree. After craniotomy, the brain tissue may swollen and the area around the surgical site might be sensitive. Elevating the head end of the bed to 30 degree can help to reduce the pressure on the brain by facilitating drainage of cerebrospinal fluid. This can help to reduce the intracranial pressure and improve the blood flow to the brain, which can improve the patient outcome. However, it is important to note that all patients who have undergone craniotomy may benefit from this patient. So, some patients it may worsen the condition. So, it is not indicated in all patients. In some cases, the bed end may need to be elevated to a greater or lesser degree depending upon the individual patient needs. But the reason why we elevate the bed is to prevent the pressure on the brain tissue and decrease the intracranial pressure. Next question, patient who had valve replacement with prosthetic valve require lifetime prophylactic anticoagulant therapy why? Patients who have undergone valve replacement with a prosthetic valve typically require lifelong anticoagulation therapy to prevent blood clots from forming on the valve. Anticoagulation after surgical valve replacement has been mitigated against thrombotic complication presumably related to suture material and swing ring that is not yet covered with biofilm and endothelize. Prosthetic valve require consideration for anticoagulation postoperatively to prevent thrombotic events. So, the reason why the patient who had artificial valve replacement need the lifelong anticoagulation therapy is to prevent the thrombotic events. In acute kidney injury, the contrast dye are avoided while performing CT scan. Iodinated contrast drugs are used in clinical medicine to visualize the internal organs since one of the property of iodine it is highly contrast density. After intravascular injection, the drug diluted in the bloodstream which allows the visualization of vessels of liver, spleen, pancreas, kidney, etc. And immediately it is distributed throughout the extracellular fluid. Being purely bound to the serum albumin, the contrast drug is freely filtered by renal glomeruli and excreted by the kidney. So, patients who had acute kidney injury, the kidney function is already diminished and the filtration of these dye will not occur completely and thus leads to accumulation of dye in the body which further increase the kidney tissue damage. That is the reason why in patients who had acute kidney injury, contrast dye are avoided while performing the CT scan because it will add on the kidney injury. Monitoring blood pressure important after repair of aneurysm. Aortic aneurysm is a balloon-type bulge in the aorta with a vessel which carry blood from the heart through the chest and torso. Aortic aneurysms can dissect or rupture. The force of blood pumping can split the layers of artery wall, allowing blood to leak between them. After repair of aneurysm, the systolic blood pressure is kept between 100 to 120 mm of Hg. They are recommended in order to maintain adequate end-organ perfusion. A much higher blood pressure may further increase the risk of tear of the suture and it may lead to rupture of the sutured aneurysm. That is why the monitoring of blood pressure is very important after repairing of the aneurysm. Humidifiers are used to add vapor to the inspired gas. Under normal conditions, the upper airway and respiratory tract are responsible to humidify and heating the inspired air, a process defined as conditioning of the inhaled gas. But this process is critically optimal conditioning of the gas avoid potential damage to the structures and function of the respiratory epithelium. That is why humidifiers are used to add vapor to the inspired gas in the patients who receive oxygen therapy. Obesity increases the risk of coronary artery disease. Obesity can change the cholesterol level. Most of us know that obesity can cause a spike in the bad cholesterol and triglyceride level. HDL cholesterol is important for removing bad cholesterol and working to reduce the risk of heart disease. It can cause the blood pressure to rise. Obese individuals require more blood to supply oxygen nutrients to their bodies, which cause an increase in blood pressure. The body will also require more pressure to move this blood around. High blood pressure is a common cause of heart attack, which sadly are more common for the obese patients. And next reason, the obesity can lead to diabetes. High cholesterol level, blood pressure and heart attacks are not only the medical conditions which we need to worry about if we are obese. Obese individuals also have much greater chance of developing diabetes, while individuals with diabetes are said to be 2 or 4 times more likely to at the risk of heart disease. Because of all these reasons, obesity can increase the risk of coronary artery disease. Nervous suction a critically ill patient for longer than 15 seconds. Suctioning can stimulate the vagal nerve, predisposing the patient to bradycardia and hypoxia. Hypoxia is one of the primary risks of suctioning. This can happen if the suctioning is prolonged. So, we never advise anyone to critically ill patient when suctioning should not be more than 15 seconds. Anticoagulants should be taken after the mechanical valve surgery. Anticoagulants are typically prescribed after mechanical replacement surgery. This is because mechanical valves have higher risk of causing blood clots to form, which can lead to serious complications like stroke, heart attack, or pulmonary embolism. Anticoagulants are the medications that help to prevent blood clots from forming by interfering with the body's clotting mechanism. These medications are prescribed in combination with antiplatelet drugs, which can also help to prevent blood clots by reducing the stickiness of platelets in the blood. Anticoagulation is required for mechanical valves to prevent valve thrombosis. Thank you. Thank you for listening. We will see you in the next session.